Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Yes, all of that plus others. Yeah.
So we have a friend that's morbidly obese.
Mm-hmm.
Young.
And now they kicked him out of the hospital. Kaiser, yes, Kaiser. And after 20 days, they kicked him out. And he wrote an appeal letter, and they let him stay 10 more days. But he's not able to do anything at his house. He can't get up out of bed by himself.
Wow, that's tough.
It is.
Yeah, that's a tough ailment.
Yeah, it is. So when you mention about people, social media and overweight, if you stay away from the subject, that's not good either.
Well, but it's not good to take advantage of people by putting false ads on social media. So it's a balance, and they decided that they would ban those things. So.
Are you talking about when they advertise that you can take this particular food and this particular over-the-counter stuff to lose weight? That's false advertising.
Yes.
Because the only way to really lose weight is to do something to change your metabolic system.
Yeah, there are a number of ways. Surgery is one way, and psychological treatments are another. And some people are effectively managed by a number of different mechanisms. So they and there's so many false advertisements that they decided to ban them.
So the surgery you're speaking of is bypass surgery.
Yes.
Mm-hmm. And I understand that before you get that surgery, you've got to make sure that the person somehow is not going to go back to those poor eating habits.
Yeah, that's what you try to do. Yes. Yeah. And so, and it's interesting how for some people it works and some people it doesn't. The psychological aspects as well as the surgical aspects. Okay, I guess it's time to start.
Thank you.
Buchanan, you can start it. So. Oh, this is an interesting one that I thought would provoke discussion, because I'm sure everybody read about how this author was supposed to get a tenure position at University of North Carolina, and they decided to accept her but not to give her tenure, and as a consequence she rejected it, and this caused a number of issues, and then she decided she would come to Howard, and she, along with Tahishi Coates, both Pulitzer Prize winning journalists, and this provoked a lot of conversation. Any of you have any different thoughts about the 1619 project that she caused so much furor? Anybody know anything about either of these people? No response, so nobody. Huh?
I don't know about the project.
What's that?
You said something about the 1619 project.
Right. Yeah, I guess many of you are not aware of that project.
Yeah.
Well,
But she,
that addresses slavery.
right. That she says that the building of the United States began with that. And so many of the, if you read some of the books, they talk about the men who built America. They talk about the white men who built America. They're not talking about all these as immigrants who actually built America and got no credit for it. And so the very idea was horrifying to many, and the white supremacists, that is. And as a consequence, although she won the Pulitzer Prize, some people were very horrified. The Republicans, in particular, were horrified by the thought that she's implying that it began with slavery in the United States. Actually, it began long before that, but that's not the issue, because it really is Native Americans' country in the first place. So we're talking about relatively new stuff anyway. The old stuff is that the country was taken from the Native Americans. But anyway, that was what the discussion is about. And because they denied her tenure, she did not accept that position. And then Howard offered her the position along with, as you noticed, I don't know if you noticed it, he got $20 million from an anonymous source to help accomplish that. So I thought it was interesting because it says a lot about America, and it also says a lot about the fact that while we are becoming a country that accepts people from other places, and we have done that, and that is our greatest strength, by the way. Most of our important contributions have come from people who've immigrated here. So, and that, I think, is one of the reasons why America is what it is today, because it has accepted people from other countries. And many people forget that the people who started America here, who took the country from the Native Americans, were rejects from their countries in the first place. So we need to be more sensitive and understanding of our history. And of course, many of us grew up, and histories were all white American history. And this effort is to get us to recognize that America is, in many ways, a blending pot, and is really founded on immigration. Anyway, those are some thoughts. Any other thoughts about this concept?
Yeah, just to put it in perspective, I would say that and the 1619 Project says that America is only a wealthy country because of the free labor from Black people. So, yeah, there's contributions from other societies all over the world, but that is like 90% of the reason why America is a so-called great country. It's on the backs of us. So I think that's a perspective I'd like to add.
Any other thoughts? That's an interesting perspective, because there's a lot of data that backs that perspective, but it also backs my perspective as well.
Why didn't they give her tenure?
Because she's Black.
Oh, okay.
And because she had the idea that America is founded by Black Americans, Black slaves. And of course, in the South, they took great issue with that because it's the truth.
Dr. Callender, the person that gave $20 million, do you think that happened possibly because of guilt?
We'll never know because it's anonymous.
Yeah, why did you give them so much money, Dr. Callender?
It's anonymous. I'm not gonna. I refuse to answer that question because it's
self-incriminating. I know.
Yes, absolutely right.
And
it presumes that I have $20 million.
But you know what? The other thing I think, if I had 100 people working for me and I didn't have to pay them anything, I'd be rich too.
Right. Yeah. And if you increase that by about couple of thousand.
You
Yeah.
know, Dr. Callender, what this whole topic brings up for me, you know, coming up, being raised up on that suspect history that we were taught. I mean, we had Negro History Week, and we only learned about 4 or 5 Black people that were, you know, athletes or opera singers or whatever, or jazz musicians, but they didn't say, and I didn't learn about this till much later. George Washington, Thomas Jefferson, all them guys had slaves.
Right.
They were plantation owners with slaves, and
Right.
you know, we're gonna tear down the Washington Monument.
Yeah, you know, it makes you wonder about the merit of tearing down these things. I think they should all be put in one location, maybe, because it's our history. Like it or not, it's our history. Yeah. Well, anyway, I thought it would be interesting to share some thoughts on that. And any other perspectives?
I'm back to tenure again. I have a friend of mine who wasn't offered a position at Howard University, but yet went somewhere else. And he was saying that the white establishments accepted him before Howard. And maybe it goes both ways. I don't know. I've heard both. And so I guess they have different criteria or whatever. Or they'll give
Absolutely. Every school has its own criteria.
right.
The difference in this case, though, is that the board denied tenure. That was the difference. Often the colleges, they make a decision about tenure and recommend it to the board. Then the board rubber stamps it. But in this issue, the board denied it. Okay, let's go to the next one if there's no further discussion. Well, this is an interesting article because it addresses natural alternatives. When we talk about prescriptions, we tend to forget about the natural alternatives. And so these are just 5 drugs to which there are natural alternatives that might be helpful without some of the side effects that some of the medications we order cause. One of the thoughts about the opioid, I guess, epidemic is that it might begin with somebody taking pain medication for a short period of time, and then wind up with them being addicted to the drug. So this is to keep in mind what are the medications that we could use to overcome that don't have the side effects. And so this is a blood pressure medicine, one of the medications that has side effects. And here's hibiscus is something that you can taste that's naturally doesn't have that many side effects. And this is a product of nature. And many of these drugs that are not found in nature do have counterparts that can be looked at. So this study looked at the antihypertensive effects of hibiscus, and they found that it was also effective and could be used in place of lisinopril without the side effects. So there's still other studies that need to be done, but it suggests that this herbal medicine could replace the drug that we prescribe so often. Now,
Yeah, I was picking up on what you just said. That okay, hibiscus can be used, and it may have other side effects. It's not a perfect substitute, but it could have other effects on the body, you know.
Yeah, we just haven't identified the side effects, any side effects of the hibiscus, but that study remains to be done. But you can see that it's just as effective. So,
Has anybody had hibiscus tea, sour tea? Because it doesn't sound delectable.
It's
it didn't
delicious.
sound that way to me.
It's delicious. The tea is delicious.
It is?
It is. It's
So
very
why do
good.
they name it sour tea?
It-
Okay.
It doesn't taste that well. The version at that they usually have in coffee shops and whatever, it isn't that sour. It's not a sweet tea, but it's refreshing. I'll put it that way. For me, I like it.
Well, Dr. Callender, I would be surprised if hibiscus didn't have side effects like other medicine, because it would dispel our saying that all drugs have side effects.
Well, that's why they talk about this, because it's not really considered a drug. It's considered a natural product that so far they haven't identified as side effects. So, and they don't consider it a drug either.
Maybe
Okay.
no side effects.
There's no side effects to water.
unless we toxic, make it toxic by stuff we put in it, which
Yeah,
has happened, of course. And then metformin is, of course, a drug that is used for many purposes, especially for diabetes. And it has its side effects, as we know, although it has been thought of as a great drug for diabetes. It does have side effects. And inositol is a sugar-derived product that can be used in place of metformin, and they're just letting you know that this is another alternative. But again, it's a sugar derived from fruits. So polycystic ovarian syndrome is not a common syndrome, so it's not something that you commonly see. Everybody knows about sleeping pills. So Piderm is one of the top 100 most prescribed drugs, and I've prescribed it myself. And some people do complain about this zombie-like state. And they recommend melatonin, although I must admit, when I've used melatonin,
Good morning.
it hasn't been as effective as some other sleep medication. So have any of you used melatonin?
Yeah, I don't like it, but melanin helps you sleep better, and you can promote your body's production of melanin by staying in sunlight. So you get that 20 minutes, at least 20 minutes of sunlight a day will help you sleep better.
My husband takes
Does it work for you?
it. Sort of.
Yeah.
In the beginning, but then he'll wake back up.
Yeah, it's been effective for some people, but for some people it's not.
I know your husband, Betty. He needs to go outside
That's just what
20
I was getting ready to say.
and get his 20 minutes, 40 minutes of sunlight.
He's an owl.
Yeah, exactly, because he stays in the house all the time. Like, you know.
Yeah.
Okay. Not tart cherry juice is nothing I'm familiar with. Any of you tried tart cherry juice for insomnia?
Somebody told my husband too when he had his knee replacement, and one of the nurses at the rehab told him about cherry juice. I don't know what they told him it was supposed to do, but for a while he started drinking it, but then he stopped. So I don't really know.
it's supposed to help you fall asleep for people who can't fall asleep, who have insomnia.
Okay.
I know my twin brother, after he's lost his wife, he had insomnia for a month, and not fun.
Heard that it was, I've seen it in the grocery store, and I heard that it was supposed to help with gout, that tart cherry juice.
Oh, okay.
Gout. Yeah.
My husband's had that, so maybe that was what they told him about. I don't know.
Then, of course, we
So,
know. Go ahead.
so it helps with insomnia too? Cherry
Yes.
juice?
Yes.
Oh,
Yes.
'cause I had.
Yes.
Okay, good.
Now, this is our transplant patients are on steroids, and there are other anti-inflammatories, but they have their own side effects, as we well know. And here we are back again to turmeric again, which is an excellent anti-inflammatory, which can be used in place of drugs like that, although I'm not suggesting you would replace that for a transplant patient. But if you're taking some other drugs for arthritis, it's worth a try anyway. Then, of course, I know you can be interested in this because proton pump inhibitors, what is used to treat GERDs, and they have their own side effects. And these are products that may be used in place of it, although I'm not all that impressed with aloe vera, but they recommend aloe vera as a product. You know, you find aloe vera in almost everything nowadays. But they talk about 10 C's reduce the severity of GERDs, which of course is aloe is not associated with as many side effects as the proton inhibitors are, especially if you're using them for years. And so it's good to know that this is an option. And you might discuss that with your doctor, John, when you're going again.
Definitely will.
See what he says about it.
I was taking aloe drink. It comes from Korea. You can get it at the Giant, but I think it has sugar or something in it, which makes it probably less effective, or other symptoms can come from the sugar, the weight gain and stuff like that. But I remember going down to the island.
Yeah.
I think it was Trinidad and Tobago, and they met us in the lobby with this aloe drink, and it was delicious. So that's why I picked up on it. I found it at the grocery store. I really like it.
You know, it's interesting. I was watching the swimming trials, and I thought of you. It's
Dr.
amazing.
Callender,
Yes.
where does reefer fall in this category?
Say again.
Where does reefer? What natural remedies?
I don't know which one you're talking about.
Right in there. That's what I was asking. They were talking more and more about what do you call it? Cambodia reefer. When people smoke.
Oh, reefer. Oh, it doesn't.
Okay, pot.
They have used when you say reefer, I didn't realize you're talking about marijuana. They have used that for eye condition, glaucoma, and they have used it in some instances for some pain relief, but it doesn't fit.
So it's not a natural remedy for?
No.
Oh.
No.
Okay.
That's one of those drugs with side effects. A lot of side effects.
Oh. Okay.
But CBD?
Yeah. There's a lot of products out with reefer. Or pot in it.
Yeah. Right. Yeah, they are. Yeah.
Marijuana.
Marijuana.
But is using the CBD oil bad when you
Yeah,
have
and they
pain,
use
chronic
that
pain?
for a lot of it
Arthritis.
is used for anorexia. It's supposed to be very effective for anorexia.
I use a CBD cream on painful joints. My doctor gave it to me and it works, but it does not have the hallucinogen in it.
Yeah, my mom uses it also, cream.
Mhm.
Maybe that's
Okay.
one thing we need to study. Maybe we do an investigation on that. Talk
Are
about
the
it.
gummy bears bad?
Yeah, there's a lot of products that take advantage of the natural form of marijuana. Right.
I have a question. If you eat the gummy bears, will they show up in your fatty cells?
Say what?
If you eat the CBD gummy bears, will it show up in your fatty cells for long term?
I don't know. I don't know the answer.
Okay.
Next one, John. This is an article on healthy foods that we think are very healthy that aren't quite as healthy as we think. And I think that speaks for itself. Some of them we don't really think are healthy, but anyway, you can go down the list. Flavored and low-fat yogurt. I think we've talked about that before. That one of the issues is they have so much sugar in them, and that has been the side effect that has been considered. Probiotics is an interesting one that that's that's great about yogurt, but the sugar content is what is the problem for yogurt. Fruit juice is another one that here again it's the same issue. It's natural, but you lose all of the benefits of the fruit. And many of, I shouldn't say all, many of the benefits of the fruit. And it's important that you should have fruit juices that have no added sugar. But even that is not as good as the fruit itself. But anyway, I like the conclusion: avoid fruit juice, stick to whole fruits whenever possible. And then the vegetable chips, thought of as a way to make eating vegetables attractive. They're often so processed that you lose the value of the vegetables. In addition to which they contain more calories, more fat. So,
What about canned fruits?
canned what?
Fruit.
Oh, I don't know. They don't talk about canned because canned fruits actually are fruit.
Okay.
The problem, I would suspect the problem with canned fruits, and at least I had to wait Darryl to give me some feedback, that they would have probably far too much sugar in them, but I don't know.
Yeah, far too much sugar. Same thing like fruit juice. Avoid the juice, avoid the cans, get the the whole fruit.
Yeah.
There's also another reason for avoiding cans. There have been a lot of studies recently that show that there is a direct correlation between aluminum and Alzheimer's or dementias. That aluminum is leached through tinfoil, cans, etc. So try to avoid anything with aluminum as well as cans.
The other thing about canned fruits is that it's the syrup that's inside the can that's really, really full of sugar. They put those canned fruits and they have a lot of, sugar in them because there's a syrup. There's a syrup inside. And again, everybody knows this, that, shelf life is very important. And so when you put salt and sugar in it, it increases the shelf life, and then the companies don't run out of business.
Yeah.
You know, I started getting pineapple. You know, and if you look at the shelf, you'll see that the pineapple chunks and bits and pieces, they can come in like plain or pineapple juice or the syrup like John was talking about. So we need to start looking at the labels,
Yeah, get it without
you
that.
know, to see how these things are packaged.
The old-fashioned way, when I was growing up, I used to help my mother can stuff, but we put them in glass jars, you know, even when you made jelly and etc. And all those preservatives, of course, it was homemade, but you would put that wax on top of it and cellophane wax. But I guess that was healthier for you because it was in jars without the cans, aluminum cans. So if you see things like, well, I know pickles have too much salt, but there are some products that are still coming in jars. Would that be safer for you than a can, like beets and etc.?
Yeah.
I don't know the difference.
Comes from your mother is always safer.
Right.
Well,
And
the next one is the low-fat peanut butter, which is interesting for those people who are worried about low fat. And the substitute is they give you more sugar, and so their conclusion is stick to the natural peanut butter. But anyway,
Yeah, they used to say stuff about sugar substitutes, and it seemed like sugar was better than some of the alternatives.
well, I don't know that sugar is better than the alternatives because sugar is pretty. We most of us are addicted to sugar, but it's killing us. And there's a lot of data that shows that much of our arteriosclerosis began with our addictions to sugar. So it's tough to be worse than sugar.
Avoid sugar, artificial sweeteners, and throw away all your aluminum pans and aluminum foil.
the thing,
Darryl? Oh, okay.
the thing about sugar substitutes, there was a link to cancer.
Right, in animals, yeah, it wasn't. And so because of that, it is thought that much of the artificial sweeteners have, except of course for diabetics who can't eat any sugar anyway. So. Granola is thought to be a synonym for healthy food. But when you look at the label, you realize it has a lot of carbs. So, any of you deal with granola?
How many grams per serving of sugar can you take if you're going to take any at all?
5.
5?
Mm-hmm.
5 grams is a good grams. Okay,
That's-
not good, but if you're
That's
going to,
daily.
no,
Mhm.
per serving.
No, per serving. No, that's not per serving. That's per day.
Doesn't sound like much, 5 grams.
No, 5 grams. You shouldn't do 5 grams a day. I'm talking about per serving. Anybody knows? Somebody wants to Google it?
Well, just divide 5 grams by 24 hours. That's all you have to do.
Well,
No, a natural
I
piece
don't
of
think we eat 24 hours a day.
right.
I tell people too.
Okay, I'll find out.
Okay. Now it's interesting. Salads I thought is a very healthy alternative, but also they, as you can see here, they have a lot of calories as well as sodium.
You know, when you say prepared salads, are you talking also about the salad in the grocery store that's packaged?
I think that's what they're talking about. And it's
okay. I thought maybe
interesting.
just talking about, you know, going to a restaurant or something.
Well, you know, Grocery stores have salad that they sell.
No, I mean just packaged in a, where the lettuce is, they have packages of salad mixed already.
Well, I think that's what they're talking about.
Okay.
Well, some of those are okay, but some of them have like the additional stuff in it, like the bacon bits and
Oh, no, I mean just
yeah.
just plain salad.
The
Just
plain
carrot
salad,
or
I think it's
radishes
okay.
or,
Right.
And they're saying that it has a lot more fat than you would want
okay.
and more sugar. Although it's interesting, they say here that some salads can have more calories and fat than a cheeseburger. That's because they have those tasty little extras in them.
Yeah.
Yeah, salad dressing is a major offender,
Thank you. That has the salt in it.
and the sugar
And the fat.
and the fat. Right.
So it's better to eat a cheeseburger than a salad.
They didn't say that. They're saying, they just said that they could talk about cheeseburger as the ultimate bad thing. The salad is just bad.
Just cut up some tomato and some lettuce and eat it.
Oh, you got it. Okay.
This is something that you might suspect anyway, that more plant-based food consumption will lower your risk of arteriosclerosis. And this is the reason why we talk about vegetables and fruits, because the meat is one of the commercials. We have the meats. The meats are what's killing us. So, and these slides these points here emphasize it, that vegetables and fruits, replacing them is a good start.
So I noticed they have a turkey up there. So
That could be a chicken.
Is that what you see that as, a turkey?
yeah, once a year in November, Thanksgiving, it's okay to eat turkey.
That could be a tofurkey, which would make it plant-based.
Well, I think it's interesting that the third item is a moderate consumption of chocolate and alcohol as well may reduce the risk.
And that would be dark chocolate.
Dark chocolate is the better version of it.
And
Like,
the version of wine would be red.
Yeah, right. And they're talking about 1 or 2 glasses a day. Yeah.
One day, 24 hours, you got to have 2 glasses of wine.
You may.
Right.
Word is may.
Right.
With or without alcohol?
This is alcohol. Wine is alcohol.
No, not in a Baptist church.
Yeah.
That's not wine.
That's grape juice.
Not wine either.
It's grape juice.
And we shouldn't have juice, right?
Well, that little bit ain't hurting nothing.
That little 3 cc's or 5 cc's. Yeah.
Okay.
Yeah. I think no one would argue about replacing red meat, because we all know that that's one of the major causes of our increased cancer risk, among other things.
You're saying red meat, that does include pork, right?
Yeah.
Beef, pork, and lamb, as it says there,
But they said that pork was white meat.
Yeah, that's why I said that.
That's disinformation.
Who said that? Who said that?
Pork
Television.
I
A lot
always
of people say that
it's
pork
red meat. Anyway.
Marketing.
Yeah, marketing maybe, yeah. But it's red meat.
They said chicken and pork is white. Well, you don't have chicken up there, so I don't know.
Chicken is out here.
If
Poultry.
they could get away
Yeah,
with
pork.
they would say that beef is the other white meat if they could get away with it.
Yeah. I just wanted to make sure pork was included in that, because my husband will die if he doesn't get pork.
Well, you can see it.
Die if he does too, huh?
Right?
There's a reason why the Hebrews didn't eat pork, because it's nasty. There's a whole bunch of possible parasites. You have to make sure that pork is cooked more thoroughly than it's just bad stuff. Just
You hear my husband say, even after it's cooked, and I said yes.
Bacon.
Well, if it's cooked adequately, it will eliminate many of those things.
But it's still bad for you.
Everything's bad for you.
Yeah, especially if you don't cook it.
Well, that goes without saying. Okay. Now, this is interesting that 3 cups of coffee and tea reduce your risk of cardiovascular disease.
I agree with that one, because last week or week before last, we talked about how coffee can reduce the risk of liver disease.
Yeah, caffeine.
Yeah, it's all related to your blood vessels, I guess.
Yeah, that talks about the advantage of the wine. 1 glass per day for women, or beer, 1 can per day. Wine, 2 glasses per day for men. And I guess the women would wonder why 2 for men and 1 for women.
Because they get drunk quicker.
Oh my
They're
goodness.
usually smaller.
They get drunk quicker.
John, you like trouble, don't you?
Yeah.
Carol, go in there and get us a couple glasses of wine.
But a big woman, 3 times the size of a normal man, can have 3 drinks.
Yeah, like this one in the picture. He can have about 4.
How to lose belly fat. That's something
Well, actually, that's a woman. Sorry about that.
Yeah, it is. You say that because of the nail polish, right?
Have to be.
No, I saw the word Julie.
Oh, okay.
Yeah, she's a Chinese woman.
That's the writer, though. That's not the picture.
Yeah.
Can't
the nail
always
polish.
tell by nails anymore.
That's what
Yeah,
I
yeah.
And she could be pregnant.
Y'all get on the subject.
2 types of belly fat, subcutaneous and visceral. It's interesting how belly fat is bad, but butt fat is okay.
say that again.
Belly fat is bad, but butt fat is okay.
Yeah, that's the badonkadonk.
That's a question.
How did you correlate those two?
The badonkadonk is always good.
What is that?
That's the butt fat. Badonkadonk.
Your sound. Something wrong with your sound, Darryl. It's not clear. Take the bass out of your sound.
He was saying butt fat is good.
It's okay. He
It's
said okay.
Yeah.
He didn't say good.
Well, it's interesting that there's that's right. So butt fat is not bad, but belly fat is lethal. That's an interesting observation. There are many studies that confirm that. And it's interesting that they allege that Black men like women with big butts. Whether that's true or not is another story. But anyway.
I was waiting for you to say that, Dr. King. Because when a woman is trying to attract a man, if she has a lot of belly fat, the man runs away. But if she has butt fat, he comes more to her.
No comment. That's
what you just said. You just said it. I was
You
waiting.
didn't say that, John.
That's what they say that that is true about us, that we prefer women who have big butts. That's what they say.
They say.
But we know that big bellies are associated with increased risk of cardiovascular disease and mortality rates.
What are some of the things you can do to reduce that belly fat? Is that in this article?
Yeah, And we talk a lot about it, but in terms of the waist measurement, you see 35 is higher than 40 is considered too much, and for women, higher than 35 is too much.
Dr. Callender, I hear that they say men who have a lot of belly fat may have liver problems. Is that true?
No, I think they
Oh,
may have many problems, but livers. Now, if you have a liver problem, you can get a fluid in your belly, and that can cause your belly to swell up.
mm.
And we call it ascites, but liver trouble can cause you to have a big belly.
Mm.
But most people who have big bellies do not have liver trouble. They're just overweight.
I know with my sister, when her belly swole up, eventually they said it was a sign of cancer, the ascites.
Well, yeah, because ovarian cancer will often manifest as ascites, peritoneal. When you have ovarian cancer, that's one of the ways it presents itself.
Yeah.
And that sometimes with the polycystic ovarian complex, so that's maybe a late sign of ovarian cancer. That's one of the problems with ovarian cancer. It's difficult to diagnose because by the time you have symptoms, the disease has already progressed.
That's right. It is a late sign. Her doctor kept
Right.
telling her she was getting fat and to exercise. So
Here's the
That's what
answer to your question, though, right here.
Well, back to what we talk about, exercising, vegetables, fruits, avoiding sugary foods, reduce your stress, meditate, exercise, aerobic exercise, lift weights. And then the thing that we tend to forget about is sleep. The problem is that when you get too little sleep, you eat too much, in addition to the many other things you do.
Talk about bad habits in general.
And the one thing they rarely talk about that we talk about is the role of meditation.
So if you get hungry in the middle of the night, it's better just to try to fall back to sleep than rather
That's
than
correct.
eat.
Drink
That's-
a glass of water instead.
Yeah, and have to drink water. Yeah. Okay. That's interesting. As a grandmother, 61 now. 10% chance of survival if she survived. Pancreatitis is one of the most malignant complications of COVID. And very few people can survive that. 10% is thought to be high.
I'm so glad that I had pancreatitis a couple of times, but it was way, way before COVID came out.
Well, most people with bad pancreatitis die, in surgery or with or without surgery. And they take out the dead pancreas, but most of the times those patients do not survive. So her surviving is miraculous.
Dr. Callender, so someone with it's a bad pancreas or a dead pancreas, they say they take out the dead organ.
They
So
take out as much as they can. Right. They can't take out all of it because otherwise you have diabetes, but they take out as much as you can. And most of the patients who have that kind of surgery do not survive.
Well, what about transplant?
Well, you can't do a transplant in the face of somebody who has a dead pancreas. So you have to wait till that process resolves before you can do a transplant. So chronic pancreatitis can be treated with pancreatic transplant, but a necrotic dying or dead pancreas has to be removed. And then after you recover, then you may be a candidate for a transplant. So it is a pretty lethal complication. Not as bad right now as pancreatic cancer, but pretty bad, pretty close.
Boy, I'm so fortunate.
You know, they gave her a gift card to the Texas Roadhouse, which is what we talked about. The food there is not good for you.
Well, that's where she wanted to go. So
So
it didn't say that the food is good there. It's just that
That was her favorite restaurant.
Right. So
they couldn't convince her to go to a healthier restaurant if there's such a thing.
oh, who wants a gift card to a healthy restaurant?
This was her choice, Carol.
Right.
Yeah, it was her choice.
Yeah. After surviving what she survived, she's earned one
day
meal at a bad restaurant. Yeah. Now this is an interesting story because people who received J&J vaccine don't need to worry because you already have it and you didn't get Guillain-Barré's. And actually, they had about 15 million people who got J&J vaccine, and only I think 100 got Guillain-Barré's. Guillain-Barré's is a type of paralysis that you get that often requires hospitalization, and it gives you temporary paralysis that often will go away. But the fact that 100 people developed Guillain-Barré out of, I think it was 12 million, something like that. So it's very uncommon, but if it occurs to you, then that makes it 100%. And they called it rare, right? And I think that 100 people in a situation where you have about 13 million Americans who actually got the vaccine is a small number, but if you're one of them, that makes it 100% for you. Now, the people who have received the vaccine, they don't have to worry because they didn't get it, but there are 100 people who did. So. And why this happens with this is it may be related to the to what the J&J vaccine is based upon. I don't know whether that's a DNA vaccine or not. I suspect it might be, but. And have you had a J&J vaccine?
Nope.
Because many people now are getting it because it's one dose. And of course, this will scare a lot of people. Those people who already didn't get the vaccine will use this as a reason, another reason not to get the vaccine.
But they said something about even if you have the J&J, you're going to still need a booster.
Well, the question is that answer is not firm yet because studies haven't been done. It is evident that most people who receive the Moderna and the Pfizer vaccine may not need a booster. But those transplant patients and immunosuppressed patients will need a booster. That's the one thing that has come out of most of the recent studies so far. And as I say, as they study more and more, you'll get more answers. But remember, the vaccine was just began testing a year ago. So they don't have data on 2 years. They only have data on the first 12 months. And the data that they have on 12 months suggests that you don't need a booster unless you're immunosuppressed.
Dr. Callender, we're hearing a lot about the Delta variant. Do you think we're going to get back as bad as we were in when COVID started? There are a lot of areas where
Yeah, I think for those people who are not vaccinated, yes. And I think Maryland and Virginia reported that 100% of those people who died from the virus were not vaccinated.
Well, we have a couple of articles about that too coming up.
Yeah, and so it's clear that the unvaccinated group are the source of many of the variants. And so it behooves all to get vaccinated. Now, this is a study that looks at the fact that children are rarely coming down with this disease and rarely having hospitalization or mortality. And so this is for those people under 12 who the question is whether the young people under 12 need to be vaccinated. But here again, the Black and Asians and Hispanics are disproportionately associated with the mortalities. 2 per million, definitely 2 per million. That's pretty rare. So, you know, when you have a low risk population, then the question comes up, is the risk of vaccinating greater than the risk of problems with the disease? And so that's the question that remains to be answered. Now, those people who have are high risk, that's another story. But those people who aren't, that's a question of whether it's worth the risk in those patients.
Let me ask a question, Dr. Callender. The vaccines that we had in the early days, back in the, like polio, did they have to vaccinate? I think they vaccinated everybody, regardless of what age they were. Is that true?
Yeah, yes, that was true. Yeah, you know, people who wanted the vaccine, yeah. Mhm.
Polio and
Yeah.
smallpox.
Yeah.
And what did they do? And I don't know if you can answer this question. What did they do about babies, you know, and mothers who were pregnant and stuff with these vaccines?
I'm not understanding your question. Say it again.
Uh, these vaccines that we had in the early part of last century, polio and smallpox, and those vaccines, how did they handle young babies under like 3, and how did they handle pregnant women during that time?
I don't know. I don't know the answer to that question. We have to look that up because you're going back many, many decades. And I don't know the answer to that question. Now, this is an interesting article that colds still remain a problem. And they're talking about these occurring more often in the summer than they used to. They used to be they were only occurring in the fall, but now they're occurring in the summer. And the thought was that most of these colds were not occurring because of the new masks and washing hands and social distancing. And some of the younger kids under the age of 6, they still have these viruses. But it is thought that if they follow the same technique that we're following for COVID that would minimize it in children. So
Calendar is the common cold. Is that a coronavirus as well?
it's thought that it might be one of, yeah. Some of them are, yeah. But they're not COVID. Here they talk about people under 5 whose immune systems haven't properly developed are still vulnerable to those viruses. And what you get is a bad cold, I think. I don't know if your grandchildren have had any of these things. Carol?
You know, usually they do have colds, but this past year or so, I haven't heard of anybody having a cold.
Isn't that interesting? And maybe because of the practices we have relative to, but the kids aren't washing their hands, are they?
We'll make them right before they eat.
Mm.
But
That's
it.
something I never get is a cold. The past few weeks, I've had a bad cold. It's better, much better, but it's dragging. And I never get a cold, especially in the summertime. Who gets a cold in summertime? At least I haven't. But this year, for whatever reason, I've had a bad cold.
Yeah, I usually get a summer cold, and I think it's because of the air conditioning in the car. I drive a lot in the car, and the air conditioning blowing on me. I think it causes me to get a cold. I don't think I like air conditioning.
Well, here they talk about reducing the risk. It's the same stuff that we're doing already. Yeah.
I have get nasal allergies and stuff with air conditionings, and it's really the blowing, the draft part. 'Cause I have an air purifier that just blows constantly, and so it makes my nose drip. So it's the blower in your air conditioner, maybe.
And they talk about those seasonal allergies that many of us have. And they talk about the fact that if you have a new loss of taste or smell, you need to think of COVID rather than the allergies.
You know, this is a time of year where people run a lot of ceiling fans. And if your ceiling fan blades are dusty, that puts a lot of pollutants in the air, which you could react as hay fever or cold or whatever. So, you know, cleaning air ducts, things like ceiling fan blades can be very important.
True that.
I agree.
This is this interesting article that talks about a church camp was linked to more than 125 cases of COVID-19.
I know exactly why. I know exactly why, Dr. Callender.
Why is that?
Because they don't wipe down the chess pieces between games. So they started doing that, you know, and it like there are 24 pieces on 48 pieces on a chessboard, and you have to wipe down each piece
I see.
before they play.
Well, it makes you wonder what's going to happen this summer as kids go off to camp and all of that.
Well, they've been playing virtually for a couple of months, but when they go back to the in-person chess camp, they're going to have the same protocol. They're going to wipe down each piece after each game.
Okay. Mm.
But there's more than just chess camp. There are other type of camps also.
Right. Well, I think this is kind of frightening, though, to see that as the kids go to camp and other camps, they have all kinds of camps now. Basketball camps, tennis camps, you name it, camps. It'll be interesting to see how this impacts COVID.
Why are they opening up the camps?
I guess because they can.
Okay, so what they're saying is that COVID is over with. Everything opens up and everything is normal.
Well, it's not normal, but it's opening. Things are opening up almost everywhere, and we act as though it's over, but it's not.
I know they're asking government workers to go back to work. DC was told to go back this week. I have a friend who works with federal government, but it's a agency under Pelosi, and they had to report back to work, I think 2 days the past week. They told them this week, don't come back. The Delta variant is too serious. They'd rather they stay home longer. So to me, that's saying a lot. Is it going to get worse, or do they think it's going to be as bad as not quite a year ago, 8 months ago, whatever? But anyway, they told them don't come back into the office.
Well, I know one thing, Janice. My sister, who lives near Seattle, works in a hospital, and just this week, they're making plans for everybody to go home and work virtually. So they're doing just the opposite. Go home.
Go home.
Yeah, work from home.
Work from home. Yeah.
Well, it's interesting because I know at Howard, as of July 26th, everybody's expected to come back to work.
Yeah, just the opposite.
Yeah.
And
So that's
DC
just-
government came back this week. DC government had to come back this week.
But the interesting thing is that, the state of Washington has reached higher than the 70% threshold.
Mhm.
And now they're doing just the opposite of what Howard is doing. I'm thinking, so that just goes to show you that we really don't know.
Right. Right. And time will tell. And
Yeah.
And deaths will tell.
Right. Now it's interesting that California is requiring face masks at school. I don't know what the DC situation is, but
They're going
anybody
back.
hear about what the it's going to happen in DC for?
Yeah, DC, they're going back.
Maybe, but
going
are they going to have to wear masks?
Probably, I would say yes, but that's just a guess. I know that we talked about this earlier, though, that all the teachers would have to have both of their shots, or one shot if it's J&J. They would have to have their shots, and the kids, they didn't say anything about whether they would have to have shots or not.
Well, so time will tell, as you said, as time moves on, we'll get more answers to the question.
That just lets you know that there's no national mandate. Everything is run by per state.
Right.
They do what
Right.
they feel is best for their state.
Even though the children may not suffer as much from COVID, but they can still carry it, So this is why I think with that Delta variant, if they get the Delta variant and they don't get sick but come to school without a mask and the teachers get it, they're going to have to shut down the school anyway because there won't be any more teachers.
Well, if the teachers are vaccinated, theoretically, that shouldn't be a problem. Now, the question is, are all the teachers mandated to be vaccinated?
Well,
Yes.
even
Yes.
if they are, though,
Okay.
Doc, all the breakthrough cases, even though they won't be hospitalized maybe or die from it, they can still get COVID.
Right, but they will at least be protected by the vaccine.
Yeah, the other thing, John, is that, just like the basketball players that came down with COVID, if a student or a teacher comes down with COVID in a building, I think you mentioned this, one case is gonna have to shut down the whole school.
That's right.
I doubt it, but it'd be interesting to see. I doubt it, especially if they're all vaccinated. But time will tell, right? Now you see what this says. CDC recommends masking indoors for unvaccinated students and teachers in U.S. schools. That's the broad sweep. I don't know how that will impact upon the local regional schools. The problem is that what about the parents of the children? Are they vaccinated?
They can't come to the PTA meeting
Uh-oh.
unless
Yeah.
Yeah, it's just amazing how, as we talked about in the uncertainty of who's going to be vaccinated, who's not going to be vaccinated. Now it's interesting the big war they're having about whether or not you should take a third vaccine shot, and that war goes on. CDC says no, you don't need it. Pfizer says it's okay to take it. Who's right?
CDC, because I think Pfizer wants more money.
Well, that nobody would argue that because that's what their company's about. They also have demonstrated that you have a 5 to 10-fold jump after the third shot. So the question is, how many people taking the third shot have side effects? That's the question. And I think there's a study that talks about that as well.
I think it's better to have that third shot ready to go if we need it.
As long as the side effects remain as minimal as they were, it's a cost benefit ratio. If you have very few side effects and they're all minor, then it may be worth it. But right now, there's a division. Pfizer says yes, and CDC says no. And the only thing that is clear is that if you're immunosuppressed, you must get a booster shot. That's just in order for you to have the normal level of vaccination and antibody production.
So is age a factor? I know they keep saying those over 70 or 75.
Say again?
Is age part of that category that may need the older people?
Except that the older people have demonstrated to have good antibody titers. It's really only the immunosuppressed group that have not demonstrated good antibody titers.
Okay. Okay. Very good.
it is true, though, Dr. Callender, that people over 70 is when their immune system starts weakening.
That's correct, but the studies did not demonstrate that there's any difference in terms of antibody protection in people
Okay.
over 70.
Thank you.
The general statement is correct. Yeah.
Dr. Callender, I have a friend who had COVID in January or something, and she said her doctors have tested her and said that she still have antibiotics and she doesn't need the vaccine. Is that true?
I don't know. You said antibiotics. Did you mean antibodies or what?
Antibodies, right.
Okay. Say it again because I thought you said antibiotics.
Okay. I have a friend who had COVID in January.
Okay.
She said her doctors have tested her and said that she didn't need the shot because she had the antibodies.
Oh, okay. So your question is?
Is that true?
It could be if they've done specific tests to find out the level of antibodies, then that could be true. Yeah.
Okay, I thought that didn't happen. I don't know. I don't know. I had a hard time swallowing that pill because I didn't know that that was happening here.
Well, they can test for antibodies, and they can find out if her level of antibodies is very high. The general recommendation is that you've had COVID, that you should get vaccinated because it will boost your immune system even higher. But the specific situation where she's had antibody tests that have demonstrated that her antibody level is very high may be an exception to the rule.
Okay.
Yeah, Dr. Callender, and you have said before that um, sometimes when a person gets COVID, their natural antibodies begin to increase in some people.
Yeah, and there's evidence that there are antibodies in some people that prevent our immune systems from developing antibodies against COVID. And so those people who don't have this antibody might be able to develop COVID antibody levels that are quite high. And so that could be an exception to the rule if they've actually done antibody testing to demonstrate how high her antibody levels are.
Dr. Callender, is it any recommendation if you have these high antibodies that you should get tested periodically or over a period of time to ensure that those antibodies stay at a certain level?
So right now, as I said, they've only been able to test people up to 12 months. So as they do more studies, they're able to answer that question. Right now, they can only indicate that well, 95% of the people who receive the vaccine have adequate antibody levels. So there's no reason necessarily to get that done again unless you think that you're immunosuppressed or have some reason to believe that your immune system is already compromised. So if you're not on any medications that suppresses your immune system, there's no evidence that you need a booster shot. Although what Pfizer is saying is that even if you have a nice immune system, you'll be 10 times as high after the booster shot. So that would mean that as long as you don't get any side effects from the medication, you'll be well protected, maybe even forever. So, so that is why the dilemma and why Pfizer is saying take the shot and CDC is saying you don't need to take the shot.
Thank you.
But and as Fauci is saying in this article, as they do more studies on these people who took the vaccine 12 months ago and it gets to 24 months, then you'll have the definitive answer. So we don't really have the definitive answer yet. And it may well turn out that we may need a booster shot. But right now, based upon the data that we have here in the United States, it appears as though you don't need the booster shot. But time will tell. That's the real truth of the matter. We don't have all the answers yet. And so that's the situation. And as we get more data that shows that most of the deaths that occur from COVID are in unvaccinated patients, it becomes even more of a requirement to get the vaccine. And that's why almost all hospitals by the end of the year will require all staff to have been vaccinated. Now this is kind of amazing that It's almost a year and a half later, and they still have state of emergency in Tokyo. And the games begin 23rd, which is next week. Next week.
Next Thursday.
Yeah.
Mhm.
Friday. Yeah.
Next Friday.
Friday. Yeah. So it's kind of interesting because this means that the only way you know about the Olympics is by news reports that TV and papers and radio. I think that's the best thing to do. Disappointing to some, but essential for all. That's interesting. Only 30% are vaccinated. That's surprisingly low for Japan. Wow. Hmm. And you notice a number of athletes have decided against participating in the Olympics.
There's one swimmer who's he's got a world record holder. He refuses to get vaccinated.
So what are they going to do about it? They won't let him in or what? No, he probably won't be able to get into the country, will he?
I haven't heard yet. He's on the team.
Oh.
He's the best in the country.
Well, I guess the country probably be without him. Now, this is an article that was very perplexing because it talks about the depression and anxiety that follows the illness because of the devastation, because of all of the losses. We're now at a point where we've had more than 4 million deaths in the world and more than 605,000 deaths in the United States. And so the grief is unending. The holes that are left in people's hearts all over the country and all over the world is unending, and the grief and depression persists and will persist for years to come. It's interesting. I remember that Charles Drew actually became interested in medicine because his sister died of the 1918 pandemic. So that mourning and grief process endures for years and years. And we're facing the same thing now.
Dr. Callender, when a person does die of COVID, on the death certificate, does it say COVID?
Yes.
I was asking that because I had read where, I think some people can be reimbursed funeral expenses for family members who have died of COVID. And they said in that article that the death certificate did not say COVID, so the person could not get the reimbursement.
Yeah, well, it's up to the doctor to write the correct diagnosis.
Mm-hmm.
And sometimes they don't write the correct diagnosis. And if they don't, then you suffer the consequences. That's tough. That's tough.
Mm-hmm.
I imagine that's a difficult determination if there's underlying conditions.
Yeah, that's what
Yeah, sometimes it can be. Sometimes it can be.
A lot of times they put on the death certificate natural causes or old age or something like that.
Well, yeah. Well, if you're over 100, that may be the case.
He can put anything when you're over
Well,
100.
under 100, but those people under 100, they should write the cause if they know the cause.
Let me look at my father's death certificate while you all are still talking.
But that's interesting.
He was 101.
Yeah.
And let's see,
I'm sure he's,
non-Hispanic. Oh, they put manner of death, natural.
I was getting ready to say,
Yeah.
it was natural.
Yeah.
Went to sleep and didn't wake up.
Right. Didn't wake up. Yeah.
But I was thinking about, we had another church member, and I may check that. She was 106, but she got COVID, is what was reported to us. And I'm wondering what her death certificate said.
That would be interesting. Yeah.
Yes.
And like Sylvia said, she should be able to get reimbursed from all her funeral expenses.
Yeah.
But anyway, Dr. Callender, right here under the bottom, I didn't see this at first. It says cardiac osteoporosis and hypertension.
Those are natural causes.
Yeah, manner of death was natural, but the cause of death, A, cardiac osteoporosis, B, hypertension.
Okay. This is an interesting article that considers these deaths preventable when you have unvaccinated parts of the country driving the pandemic. That's an interesting perspective, which is pretty accurate. And there's another article that talks about how many deaths were prevented by the vaccine. One article suggests there was about 250,000 deaths that were prevented because of the new vaccine. And of course, all of these deaths that we're talking about now from Delta, 99% of them are preventable by the vaccine. So, well, 95%. So, and so the urgency of the situation of trying to get as many people vaccinated has not changed. As a matter of fact, could be intensified. But there's still, as we mentioned before, there's still people who refuse to be vaccinated. So whatever reasons they have.
Dr. Callender, what bothers me most are the anti-mask people who are anti-vax people. Okay.
Yeah, that's a concern, all right.
They refuse to get vaccinated and refuse to wear the mask.
Well, some people bother me who, even more than those people, are the people who wear masks but don't cover their noses because they're not wearing masks properly. And so that group bothers me more than the other people. At least those without masks, they're not pretending. But those people with masks to keep the mask nose, then that's a waste of time.
Dr. Callender, what if a person, let's say a transplant person, a man who had a double lung transplant, let's say, for instance, he had been vaccinated, but he became, what do you say, a carrier. Is that possible?
I don't understand your question.
Yeah, I think my question is based on being asymptomatic. I'm talking about a transplant recipient who gets the vaccinations, both of them, but becomes asymptomatic. Is that possible?
You say yes. Now, if I'm understanding, he's been vaccinated.
Right.
Okay, and he contracts the virus, and he's asymptomatic. Yeah, that's possible.
Okay, so then that means that people, transplant recipients who've had all their vaccinations, they become asymptomatic. They can cause someone else to get the virus.
Yeah, they could. And of course, it's recommended they should get a booster shot anyway.
Yeah, booster shot plus the mask and hand sanitizer and gloves and everything.
Well, if you have an active virus, then you can transmit it
Yes.
theoretically.
Yeah, that's what I'm saying.
Yeah. Now this is a man who had double lung transplant. Now one of the things about a lung transplant, you can't get a lung transplant unless the donor and the recipient are negative. So you can get the virus, then they eliminate the virus, and then you can be transplanted theoretically. Mention he's the only member of his family who passed on getting vaccinated.
Can you say that again? Can you repeat that?
What it says here, he was the only member of his family who passed on getting vaccinated. And once hospitalized, he asked to be inoculated. So the night before his intubate, he wanted to be vaccinated.
I think we talked about this before, but if you have COVID and you need a transplant, you can't get the transplant until the COVID is resolved.
That's correct.
Okay.
Wow, that's pretty sad. Remember, we had talked about that one patient who got a double lung transplant successfully. And it's nice that he wants people to learn what happened to him and wants them to get vaccinated. Better late than never.
Yeah, that's a breath of fresh air.
Looks like he doesn't look that old either, does
The beard is not gray yet.
he? Yeah. He looks kind of young. At least under 50. Well, it really makes you really think and wonder about those people who are still reluctant. I don't know what else you can do. Anybody got any thoughts, additional thoughts? Because they raise the ante, they're giving incentives. What else can you do?
Lock them up.
Betty, you already talked about you can pay the people.
Yeah.
You get
Well, they're doing that. They're doing it.
Yeah.
My grandson still, his argument is he doesn't know what might be in the vaccine, which I think is a crazy argument.
Well, I don't expect that he will know.
That's exactly right. That's his argument, and he hasn't yet, but I'm still pushing. But it's interesting. Yesterday, someone knocked on our door, and they were canvassing the neighborhood for people who had not gotten vaccinated, and they were willing to vaccinate him at home. He wasn't here. He wasn't here, but they left a little They left a little door hanger, and I'm certainly going to give it to him. And it has where you can call to schedule a home vaccination. So
That's pretty nice. That's pretty good.
Yeah.
That's gone pretty far.
I was impressed by Maryland, PG County. Yeah.
That's very good. Very good.
Yeah.
I'll tell them what's in the vaccine.
You don't know, John.
Antibodies against the COVID-19 pandemic. That's what's in it.
But I want to ask a question. I was looking through my Afro Mac paper and I saw a article about Living Legacy Foundation of Maryland. You all familiar with that?
No.
Okay, it's an organization that promotes organ donors.
Oh, Living Legacy, I know about
Yes,
it.
Living Legacy. Okay.
Yeah.
I just wondered whether you all were.
Yeah, I'm very well aware.
Okay.
Yeah. It's a long existing
Yes.
One Legacy, well known. They're doing a good job. Yeah.
Yeah. Okay. I just wondered.
Dr.
There's a
Keller, I
nice
have a
article
question.
about them in the paper.
I have a question. Before my daughter got vaccinated, she said she just didn't trust, the vaccination process, or the vaccine. So I asked the question of her, well, what research have you done to prove your point? Well, not much, but is there like a website people like, well, she did get vaccinated, but is there a website that could help individuals become more knowledgeable of this is what's in it?
Yeah.
This is where.
Yeah, if they really want to know. All you do is you Google COVID. They got so many articles. Yes, there are plenty of opportunities if somebody really wants to be educated about it.
So Betty, I would ask your grandson, has he done research?
No, I'm sure he hasn't. just listening to what people say, I'm sure he hasn't.
Peer pressure.
There's a
website.
There's
just like, remember Chris told us that he wasn't going to be vaccinated.
Yes.
There's a YouTube channel called Black Health Matters, where the Howard University Group Hospital group session has been talking about COVID for over the last year. So they get tuned into that YouTube channel and get plenty of information and do all their research.
Okay, Black Health Matters. Okay.
Yeah, that's Darryl's program, Betty.
Nothing wrong with promoting yourself.
No, he answered your question.
Yeah, we've been talking about this for a year with plenty of research, and he gets to see articles on YouTube.
That's right.
Yeah.
That's right.
And also the CDC site has a ton of educational links.
Oh my goodness.
Every aspect of vaccinations, the virus itself, how it spreads, and the research on it.
Well, that was the question, I put to my daughter. What research have you done to justify you're not taking the vaccine? So she couldn't respond to that. So I said, so go get it. So she did. But I'm just saying, you sound like one of the mother, you know what? I just said, go get vaccinated. You have nothing to support your statement that you don't trust it. And that's the question I asked. If you don't trust it, then where's your support?
Well, you got to be empathetic. Their support comes from all the disinformation they get on social media.
Yeah,
it's not voluntary research that they're doing. It's passive because they're accepting all this disinformation.
Mm-hmm. They're just listening to their friends and stuff. But here's another question I want to ask Dr. Callen. My grandson, same one, was born with a crisscross heart. And I was wondering when they started talking about the people 25 and over getting some kind of reaction with the heart, that kind of made me start wondering. So do you think there's any, would there be any problem with him getting the vaccination with the crisscross?
Well, what they mentioned is that pericarditis which is inflammation of the sac around the heart, not the heart itself, has occurred in that it was not associated with mortality, but it has been associated with some mild symptoms that were self-limited. But side effects occur, and except that they're very uncommon.
Okay.
The other thing about Chris, I was wondering, Janice, what his excuse is, because he comes on our group session, and so he should know better. So what's his excuse?
He said he doesn't want it, period.
Yeah, but why?
He's different now, believe me. But no, he still hasn't been vaccinated.
What is his rationale? That's what I'm asking.
The fact that he's ex-military, and the military told what to do. And this is something that he has a choice, and he's decided not to. The good thing is his children now have been vaccinated. So that was my concern. Chris needs other help right now. But as a matter of fact, he injured his leg too. So he's laid up for about 3-4 months. But so he's always got something going on.
Yeah, well, I understand about that ex-military, because when you're in the military, you're told what to do, when to do it, and how to do it. And once you get out of the military, you say, hey, look, I don't have to obey anybody anymore.
That's his only rationale. So no, he still hasn't been vaccinated.
It's like John was talking about some of these people who say, close their nose and say, I don't have to do it. And then you can't make me do it, and I ain't doing it.
Dr. Callender, this is sort of off the subject, but as much input I can get from different people, I'm trying to utilize it. I think a couple of you are familiar with the case. I got a friend who has been in the hospital for a meniscus torn of the knee, obese, overweight. They sent him, he has Kaiser insurance. They sent him home. He's by himself in an apartment, and they have this home health aide, but he needs someone around the clock because he's not able to get in a wheelchair or get out. He had to have the fire department to help him. I've contacted social services, adult protection agency, and I'm trying to contact Kaiser. Yet I was thinking about going 7 on my side, because friends, we have rallied around trying to get him food. Every time the health agency comes in, whether it's a visiting nurse or the health aide, they say, oh, this is horrible. He should not be here. Then they leave and no help. And this has been over a week now. Is there any other suggestions? The fire department from Maryland say they will only come to your house 2 or 3 times, unlike DC, but I heard DC started charging too for someone. So is there any other resource that I can go to?
Is he in Prince George's County?
Yes, he is.
I will give you Picket Fences Senior Services may be able to assist, but there are basically no 24-hour assistance, anything in your home. I mean, that just doesn't, unless you have private insurance that covers that.
Okay, with Kaiser, and my suggestion, and everybody is saying that visit him from the healthcare, that he should go back into rehab,
right?
Then been sent home.
That would be the logical thing. That would be the logical thing.
But Kaiser said that he spent up their days, and it's not something that he won't recover from. It's just that they didn't give him enough time. So I'll try, if you can give it to me in the chat of who to contact, or I can call you.
Picket
Fences Senior Services.
Okay, Picket Fences Senior Services. I got it.
Wait,
I like the 7 on your side idea. I think 7 on your side is a really good resource for you.
Yeah, we could try that.
7 on your side is probably going to refer you back to Kaiser because it's the health Kaiser would have to recommend or do the prescription for rehab. But it sounds like in hospital or in facility care is pretty much what he needs at this point.
Yeah, it's